Before performing oral hygiene for an unconscious patient, introduce yourself and confirm the patient's identity by comparing her ID bracelet to the EMR record.
Hi, Mrs. Monica. I'm Connie. I'll be your nurse today. I'm just going to check on your orders. Just a second, then we'll get started. Okay, I see your name is Kathy Monica with a birth date of 10/17/1945. Great. I'm going to go perform hand hygiene and then I'll come back and perform oral hygiene for you.
Perform hand hygiene and provide for patient privacy. Prepare your work area by placing towels on the overbed table and arranging your equipment on it. Raise the bed to a comfortable working height and lower the railing on the side on which you are working. Next, apply clean gloves and test for the presence of a gag reflex by placing a tongue blade on the back half of the patient's tongue. Use the tongue blade and a pen light to inspect the condition of the oral cavity. If the patient wears dentures or has partial plates, remove them before you proceed. Remove and dispose of your gloves. If suctioning is needed, connect the tubing to the suction, turn on the machine, and test the suction catheter. Position the patient close to the side of the bed from which you'll be working. If not contraindicated by a head or neck injury or other condition, position the patient in a Sims or side-lying position. Turn her head toward the mattress in a dependent position and place a towel under her head. Verify that the head of the bed is elevated to at least 30 degrees. Apply a clean pair of gloves. Place an emesis basin beneath her chin. If she's uncooperative, has trouble keeping her mouth open, or demonstrates a bite reflex, put an oral airway in place as a block. Insert the airway upside down and then turn it sideways and over the tongue to keep the teeth apart. If possible, do so when the patient is relaxed. Do not use force. Next, suction any accumulated secretions and clean the mouth using a toothbrush moistened with water. Apply toothpaste or an antibacterial solution to the toothbrush and use it to loosen any crusts. Cleanse the surfaces of the teeth using a gentle up and down motion.
Mr. Ginsburg, I'm going to perform oral hygiene now.
A toothette sponge may be used when toothbrushing is contraindicated. Use a tongue blade to move the lips and cheek mucosa away from the teeth as you clean.
To remove the debris from your teeth.
Begin by cleaning the chewing and inner surfaces of the teeth. Then clean the outer surfaces by holding the toothbrush so that the bristles are at a 45-degree angle to the gum line. Be sure that the tips of the bristles rest against and penetrate beneath the gum line. Brush the inner and outer surfaces of the upper and lower teeth, moving from the gum line to the crown of each tooth. Be sure to clean the biting surfaces by holding the toothbrush bristles perpendicular to the teeth and brushing gently back and forth. Brush the sides of the teeth by gently moving the bristles back and forth. To rinse, moisten the toothbrush with mouthwash or chlorhexidine solution. Use the brush to clean the roof of the mouth, the gums, and the inside of the cheeks. Gently brush the tongue, but be careful to avoid stimulating the gag reflex if the patient has one. Repeat this rinsing action several times. If necessary, use the suction catheter to remove secretions as you work. If a toothbrush can't be used, rinse the roof of the mouth, gums, and inside of the cheeks with a toothette sponge. Then use a gloved finger or toothette to apply a thin layer of water-soluble moisturizer to the patient's lips. Be sure to let the patient know that you've completed the procedure and will return her to a comfortable and safe position. Raise the side rails and return the bed to the lowest position. Clean the equipment you used during the procedure. Then remove and discard your gloves and perform hand hygiene. Document the patient's oral care.